As the days go by, so are the trends of HIV-AIDS infection seemingly changing course. Contrary to the Kenya AIDS Indicator survey conducted in 2003, where HIV prevalence was higher in urban areas, the new survey depicts a different picture. Solace for the government is that the number of infected people has remained more or less the same, but the epidemic has increased in rural Kenya, with HIV prevalence among women about 4 times higher than among men.
People who are migrant workers stay in urban areas. They may be having high-risk behaviors. So when they get back to the rural areas, they are infecting people in rural areas.
Now that all is logical, actually, because people who are educated and wealthier are in a better position to protect themselves.
Nyanza province still has the highest prevalence rates, with 417,000 people infected with HIV-AIDS. Other provinces include Nairobi with 183,000 people infected, 146,000 people in Coast Province and 300,000 people in Rift Valley. Northeastern Province has the least prevalence with 5,000 infected persons. Meanwhile, HIV prevalence among uncircumcised men is reported to be 3 times higher than among circumcised men.
Nyanza, if you look at KAIS, it's got the lowest proportion of men who are circumcised. It's got the highest rate of HIV infection.
And at the moment, we are scaling up scaling up male circumcision. We have done 30,000, and we are going to target around 100,000 for this year.
However, medical experts say Kenyans still need to change their behavior to reduce new infections. For example, they are cautioning against numerous sexual partners. There are about 350,000 discordant married and cohabiting couples in Kenya, where only one partner is infected with the virus. However, what is more alarming is that 84% of Kenyans do not know their status and therefore do not access treatment and care.
Counseling and testing remains the key issue for Kenya. We have to get that target. Everybody knows their status. If that comes across, then it is the most cost-effective way of reducing HIV.
The government plans to scale up mobile clinic services in rural areas in a bid to control the transmission of the virus, as well as sensitize the communities to reduce the scope of HIV infections. Salim Bilu, Citizen TV.